Public comment. All right. Hearing none. All right. We'll proceed. I'd like to thank everyone that participated today for their very valuable comments, for their thoughts, their perspectives. Once again, I'm energized by the whole thing. I feel humbled by the challenge, but energized by the purpose. This will conclude today's stakeholder forum, but before we close, I'd like to let everyone know that the executive session that we'll be holding tomorrow will include several strategic discussions about the nationwide health information network and the NeHC activities in 2010 and beyond associated with that. More importantly, we'll spend that morning in a very deep discussion with key ONC staff talking about ways in which NeHC will further support the work of ONC and the further evolution of the NHIN. I'd like to let you know, too, that we'll be hosting a town hall at this year's HIMSS conference. Some of you participated in our town hall last year, quite successful. The theme of our session this year is Trust Relationships in Health Information Exchange. We're going to start with a couple of special guests, but much like our session last year, we'll spend some time talking interactively with the stakeholders to learn about shared experiences, challenges, lessons, the things we've learned along the way as we work to develop various trust relationships that are the foundation of successful health information exchange. For those of you that were able to attend last year, it was a very informative and, once again, I think enlightening exchange of information. Those sessions are designed to hear from you, and we structure quite a bit of that time to accomplish just that. So if you're going to HIMSS, please be sure to join us on Tuesday, March 2nd at 1 o'clock in room C208 of the Convention Center. That's Tuesday, March 2nd at 1 o'clock in room C208 of the Convention Center. We'll also be making a significant announcement at this conference, so you won't want to miss it. Last, the National eHealth Collaborative Stakeholder Forum and Board of Directors meeting will be held here again in Washington on April 14th. As soon as we have additional details, we'll provide those to you via our listserv and our website. I'd like to once again congratulate the new appointees to the board and just comment again on the depth of experience. I do wish that we were able to congratulate Janet Corrigan in person and the nominations committee, because they did a spectacular job of finding some of the most qualified people. We had some opportunity to have a little more in-depth conversations with them earlier today, and we are very pleased with the caliber of people that have joined this board. Thank you all for some very productive discussions, and thank you especially to our stakeholder forum participants for your important contributions. We greatly appreciate the efforts that you presenters made to spend some time with us, take time out of your very, very busy schedules to come and inform this board and the community. We're looking forward to partnering with you in pursuit of an efficient, secure, interoperable nationwide health information system that will improve the health and well-being of all Americans. Feel very strongly that we're on our way to creating the healthcare system that the people of America deserve. I want to thank you all for your contributions for that today. Any objections to adjourning the meeting? Hearing no objections, declare the meeting adjourned. Thank you very much.
Thank you. Bye-bye.
We will be back at 5:15, those of you that are on the board, for a special executive session of the board.